welcome back to the channel. If you're new here, we focus on practical, doctor-backed health tips, specifically for adults over 60. And today's topic is one that affects millions and millions of people, yet so few actually do anything about it. We're talking about morning knee pain. Now, let me ask you something. Does this sound familiar? You sleep just fine. You feel okay lying in bed. But the second you put weight on your legs and start walking, maybe to the bathroom, maybe to the kitchen to make your coffee, your knees feel like they belong to someone 30 years older than you. They're stiff, they ache, sometimes they even make that unsettling cracking or popping sound. And here's the part that really gets to people. After about 10 or 15 minutes of moving around, the pain eases up, your knees loosen, you start walking more normally, and you think to yourself, well, it went away, so it must not be that serious. But here's the truth. That pattern, pain when you first move, relief after you warm up, is actually your body sending you a very important signal. It's telling you that something inside your knee joint needs attention. And if you ignore that signal month after month, year after year, what starts as morning stiffness can turn into pain that stays with you all day long. The good news? You don't need surgery. You don't need expensive treatments. You don't even need to leave your house. What you need are three specific, gentle movements that wake up your knee joints the right way, rebuild the support system around them, and help you walk with more comfort and confidence, starting from the very first step of your day. Before I show you those three moves, let's quickly talk about why your knees hurt specifically in the morning. Because once you understand the why, the solution makes perfect sense. So why does morning knee pain happen? Why is it worse first thing in the day and better later? There are a few things going on inside your knee while you sleep that most people have no idea about. First, let's talk about something called synovial fluid. Now, don't let that fancy term scare you. Think of synovial fluid as your knee's natural lubricant. It's a slippery liquid inside your knee joint that helps the bones glide smoothly against each other when you walk, bend, or climb stairs. Here's the problem. When you're lying still for 6, 7, 8 hours overnight, that fluid settles. It stops circulating. It's almost like the oil in an old car engine that hasn't been started in a while. Everything gets thick, everything gets sluggish. So when you stand up and try to move, your knee joint is essentially running dry. Bone is rubbing closer to bone without that smooth cushion of fluid. That's why those first few steps feel so painful and stiff. Second, there's inflammation. If you have any degree of arthritis, and by the way, over 50% of adults over 65 have some form of osteoarthritis, then your joints experience low-level inflammation throughout the night. While you sleep, inflammatory chemicals can pool around the joint. Your body isn't moving to flush them out, so you wake up with swollen, tender, angry knees. Third, and this is the one that surprises most people, your muscles and tendons tighten up overnight. The quadriceps, the hamstrings, the calf muscles, all the muscles that support and stabilize your knee, they shorten and stiffen while you sleep. So when you stand up, your knee is not only dry and inflamed, it's also surrounded by tight, uncooperative muscles that can't properly absorb the shock of your body weight. It's like trying to open a rusty gate that hasn't been oiled in months. It creaks, it resists, it hurts. Now here's the important part. Many seniors experience this and assume there's nothing they can do. They think, well, this is just what happens when you get older. And I want to challenge that belief right now. Because while aging does play a role, the stiffness and pain you feel every morning is largely influenced by what you do or don't do to maintain your knee health. And that brings us to the three moves. These are simple, safe, and specifically designed for older adults. You can do them sitting in a chair, standing next to your bed, or even lying down. No getting on the floor, no complicated positions, just three gentle, purposeful movements that can make a real difference. Let me walk you through each one. Move number one is called the seated knee extension. And honestly, this might be the single most important exercise any senior with knee pain can do. Let me explain why, and then I'll tell you exactly how to do it. The muscles at the front of your thigh, your quadriceps, are the primary supporters of your knee joint. Think of them as the shock absorbers for your knees. Every time you stand up, walk, go up or down stairs, or even just shift your weight, your quadriceps are doing the heavy lifting, so your knee joint doesn't have to bear all the stress alone. But here's what happens as we age. If we're not actively using and strengthening those muscles, they weaken, they shrink. And when they get weak, your knee joint takes on more pressure, more grinding, more wear and tear. This is one of the biggest reasons knee pain gets progressively worse over the years. It's not just the joint wearing out, it's the muscles around the joint failing to do their job. The seated knee extension gently activates and strengthens those quadriceps without putting any strain on the knee joint itself. It's safe, it's easy, and it works. Here's how you do it. Sit in a sturdy chair with your back straight and your feet flat on the floor. Your knees should be bent at about a 90-degree angle. Now, slowly straighten your right leg out in front of you. Lift your foot off the floor and extend the leg until it's as straight as you can comfortably get it. You should feel the muscles at the front of your thigh tighten and engage. Hold that position for 5 seconds. Really focus on squeezing those thigh muscles. Then slowly, and I mean slowly, lower your foot back down to the floor. That's 1 repetition. Do 10 repetitions on each leg. If 10 feels like too many at first, start with 5. There is absolutely no shame in starting small. What matters is consistency, not intensity. A few important tips. Don't kick your leg up fast. This is not about speed. It's about control. Move slowly and deliberately. If you feel sharp pain in your knee while doing this, reduce how high you lift your leg. You should feel the muscles working, but you should not feel a stabbing pain in the joint. Do this every single morning before you even stand up from the bed or your chair. What you're doing is waking up those quadriceps and telling them, hey, it's time to work. I need you to support my knees today. And after just a week or two of doing this consistently, many people notice that those first steps in the morning feel significantly better. Move number 2 is called the standing calf raise. And I know what you might be thinking. What do my calves have to do with my knees? The answer is a lot more than you'd expect. Your calf muscles, the muscles at the back of your lower leg, play a critical role in how your knee functions. They help control the movement of your shin bone, they absorb impact when you walk, and they assist with balance and stability. When your calf muscles are tight and weak, which is extremely common in older adults, your knee joint compensates. It takes on stress it wasn't designed to handle. And over time, that compensation leads to more pain, more stiffness, and more difficulty walking. The standing calf raise strengthens these muscles and also gently pumps blood flow into the lower leg, which helps reduce that morning swelling and inflammation around the knee. Here's how to do it safely. Stand behind a sturdy chair, a kitchen counter, or next to a wall. Place your hands on the surface in front of you for balance. You're not leaning on it. You're just lightly holding on for stability. Stand with your feet about hip width apart. Now, slowly rise up onto your toes, lifting your heels off the ground as high as you comfortably can. Hold at the top for 2 to 3 seconds, then slowly lower your heels back down to the floor. That's 1 repetition. Aim for 10 to 15 repetitions. And again, if that feels like too many, start with whatever number feels manageable. Even 5 is a great beginning. Now, here's a little secret that makes this move even more effective. When you lower your heels back down, do it slowly. Take a full 3 seconds to lower down. That slow lowering, what physical therapists call the eccentric phase, is actually where most of the strengthening happens. It's where your muscles do the hardest work. So don't just drop your heels, lower them with control. And right here, I want to pause for a moment. If you're over 60, or if you're watching this because you're caring for an elderly parent, spouse, or loved one, this information matters more than you might realize. Knee pain isn't just about discomfort. When seniors have painful knees, they move less. When they move less, they lose muscle. When they lose muscle, they become more prone to falls. And falls are the #1 cause of serious injury in adults over 65. So by doing something as simple as strengthening the muscles around your knees, you're not just reducing pain, you're protecting yourself from one of the most dangerous risks of aging. Please, if this video is helpful, share it with someone you love. It might be the nudge they need. Okay, let's move on to the third and final exercise. Move number 3 is called the seated heel slide. This one is all about restoring range of motion and getting that synovial fluid, that natural knee lubricant I mentioned earlier, flowing again. Remember how I explained that overnight your synovial fluid settles and gets thick? Well, this exercise is specifically designed to gently pump that fluid back through the joint, recoating the surfaces of your knee with that slippery protective liquid. It's like priming a pump. You're getting everything flowing before you put real demand on the joint. Here's how to do it. Sit on the edge of your bed or in a chair. Start with both feet flat on the floor. Now, slowly slide your right heel back along the floor, bending your knee as far as is comfortable. You should feel a gentle stretch, not pain, just a mild pulling sensation. Then, slowly slide your heel forward, straightening the leg back out. That's 1 repetition. Do this 10 to 15 times on each leg. Move at a pace that feels smooth and comfortable. Imagine you're gently rocking your knee through its natural range of motion, back and forth, back and forth. What's happening inside your joint during this exercise is remarkable. Each time you bend and straighten your knee, you're creating gentle pressure changes inside the joint capsule. Those pressure changes act like a pump, pushing synovial fluid across the cartilage surfaces. The cartilage absorbs that fluid like a sponge, which helps it cushion better and reduces that bone-on-bone feeling. This exercise also gently stretches the hamstring muscles at the back of your thigh, which tend to get very tight overnight and pull on the back of your knee, contributing to that stiff, locked up feeling in the morning. Here's a wonderful bonus. This move is so gentle that you can do it while you're still sitting in bed, before your feet even touch the floor. Make it the very first thing you do when you wake up, before you check your phone, before you reach for the glass of water on your nightstand. Just start sliding those heels. Give your knees 2 or 3 minutes to wake up and lubricate. Then, when you finally stand up, you'll notice something amazing. Those first steps feel easier, smoother, less painful. Some people who have done this consistently for a few weeks have told me that they almost forgot what that morning knee pain felt like. That's the power of a simple daily habit. So now you have all 3 moves. Let me put them together into a simple daily routine that takes less than 10 minutes. Step 1. When you wake up, before you stand, sit on the edge of your bed. Do 10 to 15 seated heel slides on each leg. This takes about 2 to 3 minutes and gets that synovial fluid flowing. Step 2. While still seated, do 10 seated knee extensions on each leg. This activates and strengthens your quadriceps, preparing them to support your knees when you stand. Another 2 to 3 minutes. Step 3. Now stand up, carefully and slowly. Hold onto your nightstand, your bed frame, or a nearby wall. Do 10 to 15 standing calf raises. This gets blood flowing to your lower legs, engages your calves, and reinforces your balance. 2 to 3 minutes. Total time? 7 to 9 minutes. That's it. Less time than it takes to brew a pot of coffee. Now let me give you a few extra tips to maximize the benefits of this routine. Tip number 1. Be consistent. I cannot stress this enough. Doing these moves once in a while when you remember will not produce results. Doing them every single morning, even on days when your knees feel fine, is what creates lasting change. Think of it like brushing your teeth. You don't wait until you have a cavity to start brushing. You do it every day to prevent problems. Tip number 2. Listen to your body. These moves should feel like gentle work. You should feel your muscles engaging. You might feel mild discomfort as stiff joints start to loosen, but you should never feel sharp, shooting, or burning pain. If any movement causes that kind of pain, stop, reduce the range of motion, and consider talking to your doctor. Tip number 3. Stay hydrated. This might sound unrelated, but drinking enough water throughout the day directly affects the quality and quantity of your synovial fluid. When you're dehydrated, your joints produce less lubrication. Many seniors don't drink enough water. Aim for at least 6 to 8 glasses a day, unless your doctor has given you different instructions for a medical reason. Tip number 4, wear supportive footwear. I see so many seniors walking around the house in flat slippers, old socks, or even barefoot on hard floors. Your footwear matters. A supportive shoe with cushioning and a slight heel drop can reduce the impact on your knees with every step. It doesn't have to be expensive, just something with a good sole that absorbs shock. Tip number 5, don't sit for too long during the day. Prolonged sitting causes the same fluid stagnation and muscle tightening that sleep does. If you're sitting watching television, reading, or working on a puzzle, make it a point to stand up and walk around for a minute or two every 30 to 45 minutes. Keep those joints moving. Motion is lotion, as physical therapists like to say. Now, I do want to be responsible here and talk about when morning knee pain is more than just stiffness and when you should see a doctor. Please pay attention to these warning signs. If your knee is visibly swollen and the swelling does not go down throughout the day, see your doctor. If your morning stiffness lasts longer than 30 minutes and doesn't improve with movement, that could be a sign of inflammatory arthritis, which needs medical treatment. See your doctor. If you experience sudden, severe knee pain that wakes you up at night, don't wait. Get evaluated. If your knee feels unstable, like it might buckle or give out when you walk, that's a sign of possible ligament or structural damage. See your doctor. If you notice redness and warmth around the knee, especially combined with fever, this could indicate an infection in the joint, which is a medical emergency. Seek care immediately. These 3 exercises I've shared are wonderful for the most common causes of morning knee pain, things like osteoarthritis, general stiffness, muscle weakness, and age-related changes, but they are not a replacement for medical evaluation if something more serious is going on. You know your body better than anyone. If something feels wrong, truly wrong, trust that instinct and get it checked. I want to take a step back for a moment and talk about something bigger than just knee pain. One of the things I hear from seniors all the time is this: I used to be so active. I used to walk every day. I used to play with my grandkids. But now my knees hurt so much, I've just stopped. And that breaks my heart. Because when you stop moving, everything else starts to decline. Your heart health, your bone density, your mental sharpness, your mood, your independence. Knee pain doesn't just affect your knees, it affects your entire life. But here's what I want you to hold on to. It is never too late to start taking care of your knees. I don't care if you're 62 or 92. I don't care if you've had knee pain for 2 months or 20 years. Your body still responds to movement. Your muscles can still get stronger. Your joints can still feel better. These 3 little exercises might seem too simple to make a difference, but simplicity is exactly what makes them powerful. Because if an exercise is simple, you'll actually do it. And if you do it every day, it works. I've seen people go from dreading every morning to looking forward to their daily walk. I've seen people go from needing help getting out of a chair to standing up on their own with a smile. Small moves, big changes, every single day. So let's recap what we covered today. Morning knee pain happens because of 3 main factors. Your synovial fluid settles overnight, inflammation pools around the joint, and the muscles supporting your knee tighten and weaken while you sleep. To combat this, you now have 3 powerful at-home moves. Number 1, the seated knee extension to strengthen your quadriceps and protect your knee joint. Number 2, the standing calf raise to build lower leg strength, improve circulation, and enhance your balance. Number 3, the seated heel slide to restore range of motion and pump lubricating fluid back through your knee joint. Do all 3 every morning in that order and give it 2 to 3 weeks. I truly believe you will feel the difference. Now, before I let you go, I have a small request. If this video helped you, if you learned something new, if you feel more hopeful about your knee pain, please hit that subscribe button. We put out new videos every week focused specifically on health tips for adults over 60. And when you subscribe and ring that notification bell, you'll never miss a video that could genuinely improve your quality of life. Also, do me a favor, share this video, send it to your spouse, text it to your friend who's always complaining about their knees, share it in your church group or your community chat. You never know who might be suffering in silence thinking there's nothing they can do. This video might be exactly what they need to hear today. And finally, I'd love to hear from you. Drop a comment below and tell me, do you experience knee pain in the morning? How long has it been going on? And are you going to try these 3 moves tomorrow morning? I read every single comment, and your stories inspire me to keep making these videos. You deserve to wake up and walk without pain. You deserve to move through your day with confidence. And you deserve to enjoy every moment, every walk, every outing, every time you get down on the floor to play with your grandchildren. Take care of your knees. They've carried you this far. Now it's your turn to carry them. I'll see you in the next video. Stay strong, stay moving, and as always, take good care of yourself.